Good afternoon, everyone. Just getting the slides up so you can all see. Is that looking okay for everybody?
Yeah, fine. Thank you, Louisa.
Fabulous. Well, Pnawn da croeso, everybody. Good afternoon and welcome to Public Health Network Cymru's International Trade and Health Masterclass. I think this is the third in a series of masterclasses that we've been hosting. So thank you very much for spending your time with us this afternoon. My name's Louisa Petchy. I'm Senior Policy Specialist at Public Health Wales, working on trade policy, and I'll be your chair for this afternoon. But the really exciting stuff's going to come from my colleague at Public Health Wales, Liz Green, consultant in public health policy and international health and programme director for health impact assessment, as well as our academic expert, Dr. Courtney McNamara, who's a lecturer in public health at Newcastle University. Before we get going, just a few little bits of housekeeping. At key points during the presentations this afternoon and in the final kind of Q&A session, we'll be putting your questions to the presenters. So please pop these into the chat as they come to you throughout the masterclass. We welcome contributions in Welsh via the chat box as well. And just to reassure you, any questions that we don't get a chance to answer during the session, we will take away and answer as part of the follow-up to the session. This masterclass is being recorded, and that will be available on the Public Health Network Cymru website after the session. So feel free to share with any colleagues who haven't been able to join us today. If you've got any IT issues, please use the chat box and then the team can contact you directly to help fix it. You may well also have noticed that your cameras and microphones are currently disabled, but we will enable them later in the session when we have the kind of proper Q&A. Finally, we will be asking you to complete a short evaluation at the end of the session, so just keep a lookout for that link later on. This is what we will be covering with you today, with Courtney leading on an in-depth discussion of the CPTPP and what it could mean for public health and for the Wellbeing of Future Generations Act. And then Liz Green is going to be sharing some of the early thinking that we have from the health impact assessment of the CPTPP that the team at Public Health Wales has been undertaking. There will be time for a short comfort break at some point during the session. Just to start off then, I have a couple of quick slides just to give a bit of a broad context to this masterclass. So first, why are we talking about trade and health today? I'm sure many of you here will already appreciate that trade can affect health and well-being in many different ways, from the food we eat to the communities we live in, and from the employment opportunities to the healthcare services we have access to. It can also affect the natural world we live in, both on a local and a global scale. And this has the potential to create both risks and opportunities for public health and for achieving Wales's well-being goals. Crucially, the risks and opportunities from trade agreements are rarely shared equally. So with each deal, there's likely to be winners and losers, and this can create or worsen existing inequalities, particularly if successive deals continue to put the same population groups, sectors or communities at advantage or disadvantage. And why are we talking about this now? Well, as a consequence of Brexit, the UK for the first time in half a century is negotiating its own trade agreements, and there are now over 70 trade agreements in force between the UK and other nations. What this means is that the UK is able to make its own decisions about the rules that govern international trade, which could mean the rules and regulations we have got used to living with over recent decades may start to change. And if this does change, we may begin to see that affecting health and well-being in the short and longer term. The agreement with Japan was the first that differed from, but was still built on, the existing deal with the EU. And since then, the UK has signed deals negotiated from scratch with Australia and New Zealand, potentially creating a blueprint for what our future bilateral trade deals could look like. And on the horizon, of course, is accession to the CPTPP, different again as it's based on a US-style agreement and brings new opportunities and challenges. Public Health Wales has been looking at trade and health since recognising that trade agreements would be a key determinant of how Brexit would impact health and well-being in Wales. Since then, we've been working to build our own capability and capacity in the area of trade and health and trying to support the wider system in Wales to do the same. Today is really the latest instalment in that stream of work, focusing on the potential implications of the CPTPP. And to take us through that, I will now hand over to Dr. Courtney McNamara. While I stop sharing and give Courtney the chance to get her slides up and running, I'll just give you a brief introduction into Courtney. So Dr. McNamara is a lecturer in public health within the Population Health Sciences Institute at Newcastle University. She uses advanced quantitative and qualitative methods to address pressing public health policy problems and has written extensively on the health impacts of international trade, the social determinants of health inequalities, and the links between COVID-19, labour markets, and health. Dr. McNamara currently leads a large research project funded by the Norwegian Research Council. This project asks if trade shocks cause health to suffer and investigates which policies could help prevent any resulting harms. Dr. McNamara is also chair of the Trade and Health Forum within the American Public Health Association. Thank you very much for joining us, Courtney, and over to you. Your mic is muted, Courtney, sorry.
Okay, how about now? Can you see my slides?
Yep, can hear you and see the slides.
Perfect, okay, great. So I'm really excited to be here today to talk about the Common and Progressive Trans-Pacific Partnership, or the CPTPP. I think it's a really important agreement when we're thinking about health impacts, and there are some important deadlines coming up within the next year where discussing these issues will prove really important. So these are the objectives for my talk today. And what I'll do is start off with some brief background information on free trade agreements, what they are, what sort of things they cover. And after some background information on the CPTPP, we'll go through key provisions of the CPTPP that are relevant to health. And we'll finish off with some thoughts about how these issues intersect with Wales' well-being goals. Now, the goal for today is to provide you with a better understanding of how the agreement can influence health and health policymaking so that you could take forward actions in your own domains. So I want to start off recognizing that it's important not to get caught into this rhetoric that if you're critical of trade treaties, that you're anti-trade, or that if you're in favor of trade, then you accept current trading arrangements as they stand. So whether we trade or not is not the question. The question is, what are the terms of trade? What are the rules of trade? Who is benefiting and losing out from these rules? And how does this all affect health? So first things first, what are free trade agreements? Free trade agreements are reciprocal agreements between two or more countries that exist alongside the WTO trading system. Now, countries that join a free trade agreement agree to obligations that offer more liberalized trade, stronger intellectual property rights, new foreign investor protections, and more trade-related policy constraints. Now, these provisions are known as WTO Plus, and they apply only to those countries that join and ratify the free trade agreement. And this gives them some trade or investment preferences that are not available to other WTO members. Now, it's important to acknowledge that free trade agreements are not only allowed under the WTO system, but they're actually encouraged as a means of members taking seriously their commitment to further liberalize trade among themselves. So what do free trade agreements cover? Well, a range of issues with all sorts of health relevant implications. So what we'll do today is take a deeper look at some of these areas later on and precisely how they relate to health. First, I just wanted to give you an idea of the direction of the use of free trade agreements. So this graph shows the rise in a cumulative number of FTAs in force over time. And again, we can see that just recently, in the past few decades, the use of FTAs has really proliferated. Now, some of the main criticisms of FTAs are that compared to the WTO system, they intrude further on countries' policy space. Now, countries' policy space refers to the freedom that countries have to design and implement policies as they see fit. Another major criticism of free trade agreements is that they're really more about investment and regulatory issues than trade per se. And we'll get a sense of this later on when we look at some of these provisions. Now, sort of other worry that critics have brought up in relation to this free trade agreement and the proliferation is that it's created this situation that makes it really difficult to understand the implications of overlapping free trade agreements and treaties. So because these agreements are proliferating and the countries are signing up to so many, it's hard to understand which rules apply when and to who. And this idea is captured in the notion of the spaghetti bowl of FTAs. Okay, so let's move now to talk about the CPTPP more specifically. Now, as you might know, the predecessor to the CPTPP was actually another agreement known as the TPP, which was agreed in 2016 by the 12 countries listed here. But as you might already know, Donald Trump withdrew the US from this agreement in January 2017 before it was actually ratified. Now, following the US withdrawal, the other TPP countries actually did agree to revive the agreement. And in December 2018, the CPTPP came into force. Now, it's worth noting that the CPTPP accounts for over 13% of world GDP, and this makes it the third largest free trade agreement in the world by GDP. So, excuse me, this is the preamble to the CPTPP. And it states that its purpose is to bring economic growth and social benefits, create new opportunities for workers and businesses, contribute to raising living standards, benefit consumers, reduce poverty, and promote sustainable growth. And what I want to do is I wanted to put this here and then look at it again at the end of today's talk and see how you think about how some of the provisions within the CPTPP align with this goal. Now, proponents of the CPTPP claim that it's a gold-plated treaty with huge economic benefits. But of the 7 econometric studies of the TPP, which examined the potential economic benefits of the agreement, even the most optimistic ones only showed really modest gains for almost all TPP countries. So one economist actually described the gains for Australia, Canada, and the US as little more than rounding errors. Now, something to consider is that all of these models assumed full employment. So they assumed that there was no shift in employment across sectors or industries. And they assumed that there was also no change in income. If there was a change, that it was towards improvement, and that there were no other costs associated with the agreement. One model didn't make these assumptions about employment and income gains, and its findings are actually somewhat startling. So this was work undertaken at Tufts University, and it actually found that if we do consider that employment might change, that there might be some income impacts, then actually we would expect economic losses across all the high-income TPP countries and negligible economic gains among the developing countries. And even looking at all the countries together, we would expect to see a net employment loss. Now, after the US withdrew from the TPP in January 2017, again, all the other TPP signatories agreed to revive the agreement in May 2017. The CPTPP was created in early 2018 and formally signed. And by the end of 2018, it officially became into force. Now, the UK asked to formally join the CPTPP in February 2021, and accession to the bloc was originally anticipated for the end of 2022, so just by the end of next month. But Rishi Sunak has recently said that he'd like to take a little bit more time with the talks and push it out to maybe mid-2023, which is still relatively little time for these trade talks, if you consider that most trade agreements take years and years to negotiate. Now, the UK government has argued a case for the free trade agreement based on economics. But really, there's a question over whether the government's desire to join the agreement is really an economic one. And the reason why this is questioned is that the UK seems to gain very little economically by joining. So I just want to take a look at this graph. And this graph shows the amount of trade that the UK currently does with CPTPP members. Now, if you look at the blue bars, you'll see that trade with CPTPP members in 2019 represented only around 8% of the UK's exports and around 7% of the UK's imports. Now, the corresponding figures for trade and services are just over 9% of exports and just under 8% for imports. But out of the 11 CPTPP countries, at the time that this data was constructed, the UK already had free trade agreements with 7 of them. And now, of course, with these recent agreements with Australia and New Zealand, it means that the UK already has agreements with 9 of them. And so the share of the UK trade that's accounted for by these countries that it already has agreements with, and this data does not include Australia and New Zealand at this point, is indicated by these pale blue and green figures. So the darker blue and green figures at the top of the graph demonstrate the sort of economic benefit that the UK will get from trading with new countries. I think basically Brunei and Malaysia at this point. And this means that we can see or expect economic gains more in the range of under 2%. So what I want you to do is to keep this figure in mind when we're looking at the health impacts of the agreement. And one question we can ask later is whether this sort of economic benefit is really worth the potential trade-offs in health. Now, before moving on to talk about the specific health impacts, there are 2 important considerations to keep in mind. Now, per the provisions of the CPTPP, joining the agreement will require that the UK complies with all existing CPTPP rules. So it's not like the initiation of an FTA off the ground where the UK will be able to negotiate what provisions are in there or not. They're joining an already negotiated agreement and they have to accept all the rules there. The other important consideration to keep in mind is that the CPTPP is a US style agreement. Now, I mention this here because there seemed to be a lot of public outcry about a potential agreement between the US and the UK, and a bit less public debate over the UK joining this agreement. But actually, because the US was one of the main drafters of the TPP, many of the same sort of provisions and the same concerns that people brought up in relation to a US and UK agreement will also apply to this agreement. So let's move on to start talking a little bit more specifically about the CPTPP. Now, one of the most controversial aspects of the CPTPP is what's called Investor State Dispute Settlement, or ISDS. Now, rules around ISDS are found in a number of contemporary free trade agreements, and the initial idea behind their inclusion was to protect foreign investors, so to protect foreign investors from countries taking their assets from them. And this was really set up to protect foreign investors in countries that had really weak judicial systems. The CPTPP, however, and other more recent free trade agreements takes a much more extensive approach by allowing actually foreign investors to sue governments whenever they believe that a new regulation has or will impact on their profit or the value of their investment. Now, ISDS claims are usually decided by a tribunal of 3 private lawyers. The lawyers are paid quite hefty by case. And a concern here is that because only investors can bring claims, this creates a strong incentive for judges to side with the foreign investor rather than with the state, because the idea is that if they're more investor friendly, then this will pave the way for more lawsuits and more income in the future. Now, from the perspective of public health, a primary concern is the high costs that are associated with these cases. Now, I think on average, even if a state wins, a typical ISDS case will cost the government around £6 million. And this is, again, it's even if the government wins. Now, in this environment, governments may be unwilling to consider new public health measures simply because this threat is in play. And this is something known as regulatory chill. Now, New Zealand was able to negotiate something known as side letters with 5 other CPTP countries to exclude this ISDS mechanism. However, it's unclear whether this is actually an available option for the UK, again, because the UK is signing up to this agreement and it's meant to sign up to all the provisions that are currently there. So moving on to regulatory measures. Now, regulations around things like the production and sale of tobacco, alcohol, unhealthy foods are governed by rules which relate to what's known as sanitary and phytosanitary measures, or SPS, and what's known as technical barriers to trade, or TBT. Now, in short, these rules set out first the terms for how governments can use public health measures to restrict trade without violating trade rules. And second, the types of technical regulations that governments can place on goods for security or health or environmental protection reasons. Now, these rules, for example, relate to public health measures like limits on pesticides, residues in food, and they're especially relevant to labeling requirements on tobacco, alcohol, and food products. Now, what are the main health concerns with respect to rules laid out around these issues? Well, a primary concern is that they effectively rule out the use of the precautionary principle. And of course, the precautionary principle supports countries taking protective action before there's a complete scientific proof of a risk of something. Now, this concern about the agreement ruling out the use of the precautionary principle comes from language in the agreement which says that new public health regulations like labeling requirements must be based on what the agreement specifies as documented and objective scientific evidence. Now, this framing is a significant departure from the rules in the WTO or even in other EU negotiated agreements, which these agreements actually make allowances for the precautionary principle. Now, another major public health concern here is that some of the language in the agreement could lead to increased corporate involvement in policymaking. Specifically, the CPTPP includes a provision that says that each country should allow persons of the other country to participate in the development of regulations. But then when we go and we look into the general definitions of the agreement, we see that a person of the party is noted to include a multinational corporation. Finally, the TBT chapter is also thought to introduce new delays and administrative burdens in policymaking. So I put here just one example of a provision that speaks to this. And this provision says that countries that are signed up to the CPTPP should allow for a 60-day comment period before introducing new regulations. Another language within this agreement says that they should also commit to a further period to consider and respond to these comments. So it can be a very long and drawn out process of actually just designing and implementing a new public health measure. Okay, so let's move now to talk a little bit about medicines and health services. So effects on medicines and health services are laid out in rules around intellectual property rights and trade and services. So in relation to intellectual property rights, one concern here is that text in the agreement effectively locks in patent protections for some of the most costly drugs out there, known as biologics. So for example, when the patent expired on this drug pictured here, which is used to treat arthritis, the NHS was able to save 150 million pounds per year. And I think previous to that, they were spending about 400 million pounds per year on this drug. Now, within the UK regulation, there's already a very extensive allowance for this class of medicine. So biologics are already quite protected in the UK. But the main concern here would be that this agreement would lock in this protection so that in the future, governments could never go back and say, hey, you know what, maybe we need to shorten the patent period for biologics because they're so costly. For other medicines, text in the agreement has been criticized for providing pharmaceutical firms with a way to continually extend patent protections without really adding any innovation to the drug and its use. And this, of course, can delay generic alternatives, which can lead to higher costs to the NHS. Finally, there's some serious health concerns with regards to how the UK would make its liberalisation commitments with regards to health services. So the UK government has often said that the NHS is off the table, and I think it's true that they might be able to exclude much of the existing services from market competition that aren't already open to market competition. But there is really a big question as to whether any future health services will automatically be included as open to market forces. So there's language within the CPTPP that would suggest that any new services that were created, that they would automatically be open to competition. There's also concern that excluding existing services is a complicated process. So in other agreements, this has led governments to make inadvertent commitments to liberalize certain sectors. And finally, as we talked about with reference to biologics, there's a concern here that once services are offered for profit, the agreement would essentially lock in this commitment so that future governments would find it really hard to roll back on providing the service on a nationalized basis. Okay, finally, let's move to talk a little bit about labor and environmental provisions. So the main point here is that all of the rules around labor and environmental standards are far from the gold standard that proponents would like to have you believed. So with respect to labor regulations, there's actually no obligation for countries to ratify any of the ILO conventions. There's also no obligation for countries to sign up to any multilateral environmental agreement. Countries are told that they only need to uphold their already existing commitments. So in short, there's really no floor below which regulations should not fall. Finally, countries can only dispute a violation to these provisions when trade or investment between the countries is impacted. So this means really that a country can violate its labor or environmental laws as much as it wants, but not suffer any consequences or not have a case raised against it unless that violation affects trade. Now I want to just stop here and and allow for some questions that might have come up. It was a lot of material rather quickly, so I'm just going to stop my share. And Louisa, we can open up the floor.
Thanks, Courtney. That's really helpful. We've had a couple of questions into the chat, clarification questions. So the first was in terms of when you were talking about the additional barriers to introducing new policies created by, like, for example, that's 60-day provision. How long can that potentially drag things on for? Are we talking years, or is it less than that? And does that have any financial cost?
Yeah, I can't give you a specific number. Unfortunately, I don't have that on hand, but so the provisions will say something like you need the 60-day comment period. Then after the 60-day comment period, you need time to consider and respond. And there might be another, 60 days for that and another 60 to 90 days for sort of a back and forth. So I don't think it would drag it out for years, but of course it still drags it out. And in terms of costs, I mean, you can consider it in terms of the sort of, if this is about a new regulation that's offering some public health protection, then it's whatever the cost is of that delayed protection.
Brilliant, thank you for that one. Another question is, are there any precedents that you are aware of under the CPTPP where the threshold for impact on trade and investment has been met and a dispute carried out successfully?
Yeah, so under the CPTPP or similar rules, I'm trying to think. I think there was actually a case with reference to the USMCA agreement. So that's the renegotiation of the NAFTA agreement, the North American Free Trade Agreement. I think typically it's very hard to show whether trade was affected or not. But I'll have to come back to you, Charles, about whether that they've ruled whether trade was actually impacted in a case that was brought forward for that agreement.
Yeah,
I know that they have the negotiators have in more recent agreements specified a little bit more clearly what that phrasing means.
Yeah, I think that's might be one that you might have to go and have a dig around for, Courtney, and we can share anything we find afterwards. Another question here, it says, you mentioned New Zealand agreed a side letter with some CPTPP countries. Do you envisage the possibility that the UK may also be able to negotiate carve-outs from certain CPTPP obligations, including those relevant to public health, such as patents?
Yeah, so we don't know yet. I'm not aware of any certainty that the UK will be able to negotiate side letters. From what I've seen, sort of commentaries around this issue is that it's very unlikely that, the UK would be able to negotiate something as huge as a carve out for these stronger intellectual property rights around medicines. And why is that? It's because they're the first country to accede to the agreement. And as soon as the UK is able to negotiate these sort of carve outs for itself, then the worry would be that other countries that want to join the agreement would also be able to do this. So my feeling is that the other CPTP countries who have to agree to the sort of proposals initiated by the UK government would look not very favorably on that.
Yeah, and I think that's one of the challenges, isn't it? Is that just a bit of lack of transparency, really, to know about what's going on. There's a follow-up question from Charles here saying, do we even know whether the UK government is seeking to explore carve-outs or side letters? So, for example, on the ISDS provisions, like New Zealand.
Yeah, so far it's really opaque what's going on. So we don't know whether this is something that the UK government is seeking out.
And then one last question from me, really, is stealing my chair's prerogative here. I'm quite interested in with the ISDS provisions, with the status of the laws that could be used. So obviously there's brand new legislation could be challenged and you'd have to follow those procedures. But if you were just, say, to amend a piece of legislation, would it just be the amendment that's up for challenge, or would then the whole piece of legislation be up for challenge? And the particular issue we may be facing in the UK is that there'll be a change in status from the EU legislation that we've adopted becoming either repealed or becoming UK law, and whether that change in status opens any potential opportunities for challenge.
Yeah, well, in joining the agreement, the UK would have to make sure that its laws are meeting the requirements of the agreement. Now, if there was an amendment to an already existing public health measure and then it was amended, I don't know the legal details, whether that could be opened up to be challenged against the initial measure versus just the amendment to it. But I think there was a second half to your question that I'm missing.
It was just another kind of techie law one, which is that whether there's a difference, but from the perspective of that ISDS mechanism between the laws that we've kind of adopted from the EU versus domestic law, and whether that change of status would be grounds for challenge.
Yeah, it's a really great question, and unfortunately I don't know the legal details of it.
Brilliant. All right, thanks, Courtney. I think that's exhausted the questions for now, so please crack on.
Okay, well, I think we maybe can take a 10-minute comfort break here, and come back at, say, 2:50 and round out with the second half of today's masterclass. Does that sound okay, Louisa?
Sounds perfect, Courtney. Yep. So if everybody could just come back at 10:02, so just take a 10-minute break, and see you all back here at 2:50. Hopefully people are starting to drift back now, so we'll just wait 1 minute until 10:02, and then Courtney will hand back over to you.
Louisa, I don't know if you've seen, there's been another couple of questions in the chat, so that'd be marvellous. We can answer those as well.
Yeah, no problem. I'm keeping a record.
Fab, I knew you would.
Okay, Courtney, it's 10:02, so I think we can get going again.
Okay, perfect. Can you see my screen okay, Lisa?
Yep, perfect.
Okay, great. Okay, so I wanted to talk now a little bit about what some of these issues mean more specifically in the context of Wales, and how they intersect with some well-being goals that Wales has that we'll talk about in a minute. Now, of course, in Wales, the public health impact of the CPTPP is complicated by the fact that trade is a reserved matter to the government of the UK, which means that as a devolved nation, if Wales wants to have any say in the CPTPP accession process, it must seek to influence the priorities of the UK government. Now, in seeking to influence the priorities of the UK government, Welsh policymakers, of course, can take some of those specific health considerations into mind that we already talked about, but impacts can also be framed with reference to the Wellbeing of Future Generations Act in Wales and the 7 wellbeing goals that it sets out for public bodies to pursue, which can be seen here. So these 7 goals are for a more prosperous Wales, a more resilient Wales, a more equal Wales, a healthier Wales, a Wales of cohesive communities, whales of vibrant culture and thriving wealth language, and globally responsible whales. Now, we can think of ways that the CPTPP will broadly impact on a number of these goals. Leaving aside health as the most obviously impacted goal, we can think about this first well-being goal of achieving a prosperous whales. Now, this goal is all about, among other things, a low-carbon society. So here we can ask, what does it mean, for example, if the CPTPP increases the carbon footprint of imported and exported items from whales? Now, in terms of a globally responsible whales, we can think about how the CPTPP really falls short on providing any mechanisms for the improvement of labor or environmental standards, not just in Wales, but also in a number of other high and lower income countries, because there's nothing that Wales can hold these countries to account for. Now, even the most staunch supporter of the CPTPP will acknowledge that free trade generates winners and losers, especially in terms of employment. So we can ask here, how is this going to play out in terms of a more equal Wales? Now, many have also acknowledged that farmers are a particular social group that may lose out in the CPTPP. And potentially in terms of employment if cheaper imports outcompete local producers. So here we can ask, what does this mean in the context of cohesive communities, a vibrant culture, and resiliency? Now, many of you here are probably more familiar with these goals and can probably think of a number of different links to the CPTPP, and I hope that we can discuss this a little bit later on. But here I've just pulled out some of the specific national indicators that I think could conceivably be affected by the CPTPP. So we can think, for example, about how some of those regulatory issues around product and food labeling might facilitate a worsening of health behaviors, which of course would be more detrimental to disadvantaged social groups that typically also engage in less healthy behaviors, meaning not only worsened health, but also increasing health inequalities. Now, listed here are also specific environmental indicators that we might see shift. So there's one, for instance, referencing levels of nitrogen dioxide in the air, the global footprint of whales, and the emissions of greenhouse gases. Now, if concerns about employment in general and farmers specifically come to light, we might also see some changes in the percentage of people in employment, changes in the gross disposable household income per head, the mean mental well-being score, and the percentage of people who feel that they're able to influence decisions that affect their local area. Now, I think, in fact, that if the entire CPTPP accession process was more widely publicized, that in itself might affect how people think about their ability to influence decisions that affect their local area. So to start wrapping things up, we looked at this preamble before, and I'd like you to take a look at it now and sort of reflect on the fact that this is one of the few parts of the agreement that actually isn't enforceable. So preambles to free trade agreements aren't enforceable, unlike many of the provisions within them. And I'd also like you to reflect on the fact that it seems like the economic gains from the CPTPP are not only very small, so here we talked about maybe a 2% change, but also don't account for some of the costs that we discussed, like those coming from the ISDS cases or those coming from higher medicine prices. And what I've done here is I just popped in these two papers which go into further details on some of the things we've talked about today, and they're open access. I'll also pop them in the chat shortly. But I wanted to finish off with a list of reforms that have been proposed in the public health community to safeguard public health in free trade agreements. Notice, however, that many of these proposals aren't really relevant to the UK joining the CPTPP simply because they presuppose that a government actually has some room for negotiation. So, of course, it is possible that some of these recommendations might be addressed in side letters. That remains to be seen. But I was thinking about this, and I think that perhaps the recommendation that's most useful in the case of the UK joining the CPTPP is actually this one, for the government to undertake a health impact assessment of the agreement, so that the impacts and the trade-offs of the agreement can be more fully understood and widely debated in the public realm. And with that, I think I'll hand over now to Liz.
Thank you very much, Courtney. Amazing. And I noticed there are a couple more questions in the chat, so Louisa will give those to us at the end. So I'm going to talk about the health impact assessment that we have just carried out, we being the Wales Health Impact Assessment Support Unit. Can you see that, Louisa?
Yes, all good, Liz. Thank you.
Fabulous, thank you. So I'm going to talk to you about the health impact assessment of the CPTPP that the Wales HA Support Unit and the policy team in Public Health Wales in their WHO Collaborating Centre have just carried out. And we're just at the end of this. I'm going to give you a flavour of what we found. I mean, it's not been published yet, but it's it leads on quite nicely from what Courtney said, and a little bit about how we've carried it out. So, okay, so for those of you who don't know what a health impact assessment is, Courtney's just referenced that some of the suggestions for public health where that health assessments were carried out, and a lot of the time that means health impact assessment. So this is the ultimate definition of HIA, but actually in a way it's just a simple common sense approach that says, will this policy, plan, project have an impact on health, well-being, equity? If it does, who will it have an impact on, which population groups, and how will it have an impact? So which determinants of health, which are aligned quite nicely with the well-being goals, will be impacted? And is there anything that we can do about it? So are there any opportunities or any positive impacts that we can maximise? Are there any potential negative impacts or unintended negative impacts? Because, you know, as Courtney described, the preamble is all very aspirational and we want to make people's lives better and countries' wealth better. But you know, so many of these policies and plans are actually, or trade agreements in this case, have unintentional negative impacts, even though they acknowledge that there are some winners and losers. And what can we do about that? Is there anything we can mitigate to reduce those negative impacts? And HIA is the main vehicle with which you drive health and all policies. So it's that way of trying to find synergies and windows of opportunities between different sectors in order to reduce those negative impacts and actually sort of strengthen and improve plans and policies. So that is the actual definition of health and all policies, and you can see it seeks synergies, it avoids harmful health impacts, and it looks at health equity in the round. So the aims and the objectives of our health impact assessment on the CPTPP were to sort of better understand and identify the actual health, wellbeing and inequalities impacts in Wales, the who and the how in the population. This is only the second ever health impact assessment ever carried out on a free trade agreement around the world. The first one was the forerunner that Courtney referred to, the TPP, and it was carried out in Australia, which again has different context. But some of these key themes keep emerging around, you know, medicines and patents and ISDSs. But what we found is that actually, as a public health professional, we have such a lot of jargon, but similarly, trade and these trade agreements have such a lot of jargon, and you know, they're very legal documents. They're written by lawyers, they're judged by lawyers, the ISDSs are overseen by lawyers, so it's all about that terminology. And I think from working on the Brexit health impact assessment in 2019, which highlighted that trade and free trade agreements are key determinants of health, it's made us think, well, as Louisa set out, that we need to upskill, educate and inform a wide range of professionals about these health and wellbeing impacts. And in this case, it's the CPTPP. But also we have a window of opportunity now because the negotiations are still going on. Now, although we understand that the UK accedes to the CPTPP and those provisions and regulations are set, it doesn't mean to say that we can't try and influence the advocates, not only for public health at the table, but Wales for the table, and try and sort of influence some of those future provisions if it could be revised in the future, or around things like those side letters. So the methods that we followed out, HIA is very systematic, evidence-driven process, and that's evidence of all kinds, and it looks through those determinants of health, so which align very much with the Wellbeing of Future Generations Act, so social impacts, health behaviour impacts, environmental, economic, access to services, climate change at the macro level. So health impact assessment in Wales very much looks at for HIA through the lens of the determinants of health and the population groups, so that equity lens as well. And we realised that we had to carry this out very quickly. So you can see it's been carried out in a very short time frame. The scope for us is Wales only. And although we've carried it out in a rapid time frame, it's comprehensive in its scale and its scope and its use of evidence, and it's participatory. So we engage with a wide range of stakeholders. We've interviewed a number, and we've taken some of this work to other stakeholder groups around trade and trade and health. It's also of relevance, we think, and transferable to other devolved nations. So I'm thinking particularly about Scotland here, although their context in terms of their population health profile and demographics might be slightly different. But a lot of this learning is transferable. And the HIA assesses both those positives and those negatives or unintended negative impacts. The population groups who might be those winners and losers. And I will say that what I'm just going to talk about, I can't, obviously, it's not published yet. I can't talk about this in any detail, but I'm just going to give you a flavour of some of those major impacts. And in terms of the participation, we've engaged with maybe a number of you online, but also within Welsh Government, with trade groups, health economists, agricultural sector representatives. So it's been quite broad ranging in many ways. So what determinants of health and wellbeing did we find that CPTPP could affect in Wales? So the positives were those economic impacts. It could enhance some access to services. So it could encourage a workflow workforces flow between nations. It could encourage healthcare research and development collaboration. So, for example, because there might be incentives around increasing patents and the longevity of them and the money that people make, it could encourage those kind of collaboration and research and development. And so they're just a few of those positives. And I have to say that they were primarily the main ones. There are very, very few positives or opportunities otherwise that we could identify from the evidence around the peer-reviewed literature, the grey literature, some of the policy documents that we examined, and also those conversations with key stakeholders. Potential negatives, again, economic impacts on specific groups, those on low incomes or who may be socially disadvantaged, those who access healthcare services regularly or have long-term life-limiting illnesses or chronic conditions, again, because the medicines, the patents, the cost. There's also health behaviours, which Courtney alluded to, which is in terms of some of the regulations around labelling for tobacco, alcohol, the content of food and the cost of food, so it would have an impact on nutrition and diet, and some of these sort of standards around environmental quality, and the fact that some of them could actually, once we've got standards in terms of public health policy as well, then we could have a situation where we've got regulatory trill. So we might want to, as Wales, policy for health and healthcare services and social care services are a devolved matter. So public health policy in Wales is quite progressive. So we have a Public Health Wales Act that says, you know, that has regulations around smoking, for example, in public places, or it encourages the use of health impact assessment by public bodies. It may be that if Wales wanted to introduce different public health regulations or amend that act in the future, we might not be able to because it would be open to challenge. So the impacted population groups, health and social care workforces, like I said, those with limiting illnesses, those on low incomes, agricultural workforces and farmers and fishers. Again, around some of these provisions. So, you know, we know that we're having the UK and other nations are having bilateral agreements that have been of concern around the agricultural workforce. I'm thinking mainly here of New Zealand with the dairy industry, but also the CPTPP and the RAND could have a massive impact, and also on business owners. And particularly in Wales, we have a number of small business owners, and it could have a massive impact on them. So the main findings, again, follows on really from a lot of what Courtney said. So it has a wide-ranging impact across all the determinants of health. There will be winners, there will be losers, and potentially that could widen existing health inequalities, of which we know that we have a hardcore element in the UK and in Wales. HIA has not been carried out by the UK government on the CPTPP. Like I said, this is only the second one that's ever been carried out. And I can certainly understand why, because of that lack of transparency. There's a range of unknown unknowns, for example, around the NHS, what's on the table, what's off the table, what's included, what's not, what's excluded. And also when we were interrogating the evidence base, there's not a lot of robust peer-reviewed evidence around the impacts, and particularly the health impacts of these trade agreements in whatever shape or form that they are. So more research is definitely needed. And that as we've talked about, the side letters are very important for public health. The Australian agreement had a side letter around tobacco. So there is scope, and they are important for public health for a range of different reasons. So there are a lot of benefits as well to use of health impact assessment in free trade agreements. And I think one of the things that we should advocate for is not just public health in trade, but actually the use of HIA in trade. And I will say that I can definitely see why this is only the second one. It has been quite challenging in many ways, but it's been very rewarding because we do have that window of opportunity to put our summary evidence paper into the hands of the UK negotiating team as it stands currently, which is a major thing for us. Doesn't mean to say that they can act on it, but just planting these things and making people aware of them is a good thing, I can see. So HIA promotes greater equity. It definitely is a way of saying this is evidence-based, and these are those impacts, determinants and population groups who will be affected both positively and negatively. It's not just a negative tool, so it will identify positives and opportunities and can actually add value in many ways about engaging different sectors to have these conversations and different partners, and therefore it can help strengthen some partnership working and increase the awareness of what we're all doing in a range of ways. So that's from me now, and I'm happy to take any questions on that as well.
Thank you very much, Liz, for that really helpful summary of the health impact assessment work. We've got a few questions now for yourself and Courtney. I don't know, Public Health Network Cymru colleagues, I don't know whether you want to allow everybody to have access to their cameras and microphones in case any of the people who've asked the questions on the chat would like to do so in person.
Yes, I think if people put their hands up, as in virtually, I think Jamie will be able to allow access to the mics.
Brilliant. Okay, well, I'll just give there's a couple of people who've asked questions, so I'll just give them a chance to put their hands up if they want to. Otherwise, I will happily put their questions to Courtney and Liz myself.
Louisa, maybe I could start coming back to one of the questions that Charles had asked, and that was about whether there was any precedent under the CPTPP where the threshold for impact on trade and investment was met and a dispute was carried out successfully. So I went back and looked through my notes. There's only been one case that of a raised labor dispute, and it wasn't in NAFTA, it was CAFTA, so the Central American Free Trade Agreement. And the US raised the case against Guatemala, and that case failed in that, and it was a problem over precisely that language around whether these labor violations were affecting trade. And there was no, the panel ruling on it decided that there wasn't sufficient evidence to say that it was affecting trade. So that's been the only case so far that has been raised around that wording. But it's worth noting that in the most recently renegotiated form of NAFTA, the US did put in text that makes it a little bit easier for cases to be raised against individual companies that might be doing labor or might be having labor violations. So before, like in CAFTA, a case could only be raised against the government, but now in this new version of NAFTA, a case can be raised against an individual company, which might make it easier to raise a labor dispute. And they provide a little bit more conceptual clarity around what they mean in terms of it affecting trade and investment, because that was really it was on those terms that the Guatemalan case failed.
That's a really interesting example, and yeah, I suppose yeah, quite depressing that we've only got that one example and it didn't work. So I've got a couple of questions to put to you then. So the first is just following up on that point about corporations or their advocacy groups being required to be involved in domestic policy development. The question is kind of, what does that actually look like? Are you aware of it being kind of a formal process that takes place, or is it more kind of informal discussions?
Yeah, my understanding is that it's only specified within the agreement that the corporation must be given an opportunity to comment on terms that are no less favorable to what's given to other people. So if the UK government wants to implement a regulation and they open it up for comment from the public, then the corporations are also allowed to comment. I think it's worth noting, though, that the text says they have to offer this opportunity to corporations on terms that are no less favorable, but they don't say that they cannot offer them on terms that are more favorable. So you can go to the Department of Trade website, I believe, and you can see all of the meetings that they have, and they specify who they're meeting with, and you can see some connections to private investment, but that's all you can see. You won't, for instance, see the minutes of that meeting. So I think you raise an important issue.
Yeah, I think that the language of the no less favourable is also what I wrote down. It's always the devil's always in the detail with these provisions, isn't it? Thank you very much for that answer, Courtney. Next question, I think probably is you're quite well placed to answer, Liz. So it's are Welsh Government and other devolved governments across the UK appropriately aware of the potential impacts of trade agreements like the CPTPP on public health? And that the question sort of frames it from the perspective of, obviously, negotiating these trade agreements is a reserved power, but a lot of the things that it impacts, like health, are devolved. So yeah, what are your views on that, Liz?
I think yes, but it depends on the perspective. So, for example, we do know that Welsh colleagues are aware around it in the impact of the CPTPP, as they are on many other of the FTAs that are going through. But I think, we bring that particular public health lens and that equity lens that will help draw all of this out. Because, for example, using Scotland as an example, we have Scottish colleagues who are very aware of trade and the trade implications, but they're very focused on health behaviours, so tobacco and alcohol and those kind of things. So I think we can bring that broader lens, and I think that's helped. We have a number of conversations with Welsh Government colleagues around that, and I know you've been part of a group, Louisa. So, and we've helped support, some of the responses around, for example, previous agreements like the Australia one, or at least, we can add that public health lens to it.
Yeah, I think it's definitely getting better. I'm just thinking back to the findings of the Brexit HIA, Liz, where one of the things you highlighted was that need to build capability and capacity on the relationship between international trade agreements and health. And I think, that was in a way what's kind of inspired a lot of these masterclasses. And I think there's definitely a greater awareness. But I feel like from the stakeholders that are sitting within the trade policy space, I think the awareness is increasing of potential implications for public health. But I would probably say that we've still got quite a bit of work to do to get people who are thinking much more about their own public health spaces or other policy spaces to start thinking about trade like the other way around.
And I think it's interesting as well. We have colleagues, as you know, across the UK who sometimes come at it and are then very, new and fresh and very surprised. And then you've got to explain even like things like the complications of the Internal Market Act. But we won't go there.
And I just wonder, Courtney, whether you also have a kind of a broader perspective on where you think the sort of trade and health debate has got to.
Yeah, I think it hasn't gotten far enough. I don't think that there's a lot of coherence between the two policy groups. I think there's still a long way to go.
Okay, Next question, again, kind of sort of probably more for you, Liz, which is just asking about the health impact assessment, and whether this focused more on the impacts on Welsh citizens, or whether it also looked at the broad impacts on communities of other countries. So thinking about that kind of globally responsible global climate footprint for Wales.
Yeah, thanks, Bronya. Nice question. So it's, yes, the scope was Wales only. So primarily we've looked at the impact on Welsh citizens because, you know, there are 11 countries in the CPTPP, and I'm sure that there will be impacts on their communities. But I think in terms of the trading impact, that definitely comes under the environmental impacts and things like climate change, for example. So because we know there'll be more transportation, more imports and exports, so that will naturally have an impact, not just for us, but globally, in terms of global warming, etc., etc. But in terms of the actual scope on the communities, it's the Welsh population only.
Thanks, Liz. Did you want to add anything to that, Courtney? Okay, so this was probably more for you to pick up, Courtney. So it's asking for a bit more detail about the potential negative health impacts of the CPTPP regarding health behaviours, so that the food, alcohol, tobacco. Just whether you could give any reflections on how the CPTPP compares to other existing trade agreements in terms of what it's stipulating.
Yeah, I mean, it almost exactly mirrors other US style free trade agreements. So if you look again at this, the USMCA, the renegotiated NAFTA, many of the provisions are very similar. It's an important step away from the WTO provisions in the ways that I mentioned, such that it rejects the use of the precautionary principle. It allows for this, or even facilitates this corporate involvement in policy making.
I wonder whether, Courtney, you want to just go into any more detail about what it means when you say a US style agreement, because I think that is one of the kind of distinguishing features of the CPTPP from a UK perspective in comparison to some of the other deals it's already got. So I wonder if you just want to talk a bit more about that.
Yeah, so basically the US has a very particular style of undertaking trade negotiations, and basically if you look across all of the agreements that the US is part of, you'll find very, very similar language in all of them. So that's what I mean when I say a US style agreement.
Fab, thank you. I saw a hand flash up. I think it was Charles.
Thanks, Courtney. On the tail end of what you just said about, you know, that distinction between US style and typically US style, EU style trade agreements, I was wondering whether the CPTPP has any mechanisms built or written into it for regular review or engagement around labour and environmental provisions. Because in EU trade agreements, as you know, we do typically see those civic society mechanisms built in to at least enable a discussion around these issues. And I was wondering whether there was anything similar or comparable in CPTPP.
Yeah, there is some similar language in the CPTPP where like informal discussions should take place before a formal dispute is raised. And I think it also sets up a sort of labor committee where members of the countries meet regularly to discuss any potential labor issues.
Does that answer your question, Charles?
Yeah, I mean, I suppose that for me, there would be questions around, I mean, obviously the provisions themselves in the treaty are quite weak to begin with. So I was wondering whether are there any written records or any precedents or any analysis or study of how these mechanisms work, or to whether they know whether they're effective, whether there's a drive towards reform. And I wonder, thinking to what you were saying, Louisa, and this earlier about if the UK were to accede and there was later an opportunity to review the text of the CPTPP, whether this is something we might push on for more independent engagement around these dimensions of trade moving forward within the trading bloc.
Yeah, so broadly speaking, I believe that there's a requirement that these meetings are published and the details are open to the public. So they should be able to go into any of the countries, say Australia, and find minutes from any of the labor meetings they've had, if they've had them yet. I think they might be set out just for 5 years from when it's initiated. So that would be still from 2018, 2023. So there might not have been a meeting. I'm not aware of any analyses of those meetings, but I do know that there have been some different sorts of analysis that have tried to get at the answer of whether these provisions make any difference to labor conditions. And I think the resounding answer is no. But there's one exception to that, which is when a country like the US requires that a country do something like ratify an ILO convention before it even starts negotiating the agreement with them. So I think that's the one exception to the rule.
Great, thank you for your question, Charles. Thank you very much for that, Courtney. I'm going to squeeze in one last question, Courtney, just to get your thoughts on it. So you were talking about the environmental provisions and how it's not possible for a country to kind of hold another member to account unless them kind of moving away from those environmental protections has an impact on trade. And I just wondered whether you thought that if the UK's trading relationship with some of the CPTPP members focused on green technologies, whether that would provide sufficient grounds for them to also be able to uphold those environmental standards, because it would impact on their interest in trading in those kind of green technologies.
So where does the violation come into play?
If they just started to back away from their net zero commitments.
Oh, okay. So if a country has a environmental law in place and then they shift downwards away from it in a matter that affects trade and investment, then conceivably a violation could be raised.
So maybe, but we're not sure. All right, thank you very much, Courtney and Liz, and thank you everybody for your great questions. I think that's all we've really got time for today. So just thank you very much for joining us. As I mentioned at the start, we'd be really grateful if everybody joining the masterclass could complete a short evaluation. The link is in the chat now, so please click on that and just spend a couple of minutes before you disappear. And if you're not already a member, we really hope you consider joining up to the Public House Network Cymru, so you can get to hear about the other sort of fantastic events and information that they share. Finally, if you've got any thoughts on future webinar topics you would like, then please do get in touch with the Public House Network Cymru team, because they're always keen to hear what you would like to be hearing about. So that's it. Thank you everyone for your time this afternoon. Thank you particularly to Liz and Courtney, our speakers today, and please enjoy the rest of your afternoon.